So in this video, let's talk about systemic lupus erythematosus. So it's also called SLE or also just called lupus with just the middle, name. So systemic means almost all your systems are affected, and this is an autoimmune condition. All right. So there will be auto antibodies and all of that. And so what is autoimmune? So autoimmune is self destruction of your immune system. So your body itself is destroying your immune system. So your immune system is gone, so that will lead to many more inflammations, and all of that is gonna happen. All right, multiple systems are gonna be affected because of that inflammation happening. All right. So in general, the non-specific, very vague symptoms are fatigue, fever, and mouth ulcers. Mouth ulcers are almost seen in almost all the autoimmune conditions. Okay, so this is the most important thing. So in skin, as soon as you see this rash, the one that this patient has, it's called a malar or butterfly rash. So as you can see here, it is in the shape of a butterfly's wings. All right, and you can also see that the patient's nose, this part is spared. So this patient doesn't have any redness or any rash on her nasal part, right? So her nasolabial parts are spared. All right, and one differential to this rash is lupus pernio. So in lupus pernio, the patient has a rash all over her, nasal part also is affected. So it will be all over her cheeks, also her nose and her other cheek also. So it will be continuous, like the whole complete, this part is affected. This part is all red. Alright, so and here her nasal part is spared. So that is the differentials, and lupus pernio is seen in sarcoidosis. And the next one is photosensitivity. This is also almost seen in all the autoimmune conditions. This is nothing. Photo is sun or any kind of light, and the patient will be sensitive. So whenever she goes out in the sun, she starts getting some rashes. Alright, and the next thing is Raynaud's phenomenon. Although this is not specific to this condition, it is also seen in many conditions, but it is important to know what it is. So Raynaud's phenomenon is nothing but, you can see here, this patient has here pale fingers. Okay, and the same patient, the three hands are the same patient. So here it is pale, here it is all blue and bluish, so cyanosed, and then here you can see it's a little bit red. Although it's still cyanosed, there's also some rubor or redness. So the fingers start turning pale, and then followed by cyanosis, and in the end rubor. So why this occurs is, there is episodic vasospasm of the arteries here. So here suddenly the artery gets stenosed or constricted, and then suddenly it gets normal, and then again stenosed, normal, like that. Episodic vasospasm leads to all these different colors. All right, because of impaired blood flow. So episodic vasospasm in the extremities leads to color change. And this is usually especially occurs when the patient is exposed to cold. And the treatment for this condition is nifedipine, which is a calcium channel blocker. So it keeps the arteries from not getting constricted. So that's all about the skin. So the next system we're going to talk about is respiratory. So this is nothing, it's just inflammation. All right. So your pleura gets inflamed, so that leads to pleuritis. Your pericardium gets inflamed around the layer around your heart, that gets inflamed, and that leads to pericarditis. So this is just simple inflammation. All right. And when your kidney is affected, again this is inflammation. So glomerulonephritis is seen. So this is also almost seen in almost all the autoimmune conditions and vasculitis conditions. And the most common glomerulonephritis type seen in SLE is diffuse proliferative. All right, and your joints are also affected almost in all the conditions. Joint pains, arthralgias will be seen, and symmetrical polyarthritis will be seen. So what symmetrical polyarthritis means is when your elbows or when your shoulders are affected, both bilaterally they are affected, both the sides they are affected. So your hands, both the sides they are affected. So it's not like one knee is affected and one ankle. That is not symmetric. So it is both your knees are affected at the same time, or both your ankles are affected at the same time. And the main very specific thing with SLE is this Liebman-Sachs endocarditis. So it is a type of endocarditis seen specifically with SLE. Alright, so you can remember SLE with LSE, Liebman-Sachs endocarditis. So this is a good mnemonic to remember. So this is like a revision of all the symptoms. So the systems affected here are, you can see, systemically fever and photosensitivity. Mouth and nose will have ulcers, muscle pains, joint arthritis, inflammation. Face will have butterfly rash, malar rash, it is a very specific thing. And fatigue and loss of appetite is again non-specific. Fingers and toes, the patient will have Raynaud's phenomenon. Alright, but this is also seen in other conditions, not just in SLE. Alright. So when you suspect SLE, the first test you do is ANA followed by DNA. Alright. So ANA is the most initial test or the most sensitive test done for this condition. So ANA, if the patient does not have antibodies to ANA, that means the patient does not have SLE. It is a very sensitive test. It is highly sensitive. And once this is positive, and if still SLE is suspected, then the patient gets a dsDNA test. So double-stranded DNA test, which is very specific to this condition called this condition. Alright, so this is highly specific, and it is the most discriminative test done, or the test to confirm. Anti-Smith antibodies are also seen in this condition. And then the patient will also undergo complement level test. So complement levels are usually affected because your immune system is affected, right? So your immune system is dying. So complement levels will also be decreased because these are what do your immune thing, right? Immunity, right? So these are decreased. And then antihistone antibodies are something very specific to drug-induced SLE, which we'll talk about later on. Next thing we're going to see is the management for SLE. So whenever somebody is asking you for the treatment of SLE, it's nothing but hydroxychloroquine. So SLE hydroxy, just remember it. It's just memorization. SLE hydroxy, bus. And this helps with the skin lesions, that is malar rash and photosensitivity and all of that, and also with the pains and oral ulcers. Alright. And then you do symptomatic therapy. So NSAIDs we give for pain, arthralgia, algia or myalgia, and prednisolone for to reduce the inflammation going on. And same thing, to reduce the inflammation, prednisolone steroids are usually followed by cyclophosphamide. This is also the same in vasculitis. Alright, in vasculitis also, in any type of vasculitis we give steroids, which is followed by cyclophosphamide always. And then the last thing that you have to remember is life-threatening lupus nephritis. If the patient specifically has nephritic symptoms, which are, dominating nephritic symptoms, which is also life-threatening, then the patient has to get cyclophosphamide. Alright. So like we said, we'll discuss drug-induced lupus now. So drug-induced lupus is nothing but drugs leading to SLE. Drugs leading to lupus. Okay, some drugs like side effects lead to lupus, cause lupus. So it's the same again. The symptoms are same. Lupus affecting all other different systems and inflammation, malar rash and all of that. But then it is not autoimmune. It is the drugs that is causing it. Alright. So a very specific antibody seen for this condition is antihistone antibodies. So you can remember it as His drugs causing lupus. Alright. His for histone and drugs for drug-induced lupus. So His drugs causing lupus. So the drugs which you have to know for this condition are, you can remember with the mnemonic SHIP. Alright. Sulfonamide, hydralazine, isoniazid, procainamide. So sulfonamide is a antibacterial drug. Hydralazine is a hypertensive drug. Isoniazid is given for tuberculosis, and procainamide is a type of antiarrhythmic. Alright, you can also remember it with the mnemonic CHIP for the same CHIP. C for chlorpromazine, which is a antipsychotic. So I am giving this mnemonic chip so that we can remember the management of SLE as well. Although management of SLE, we don't need a mnemonic really, because it is usually symptomatic and you just have to remember this. But still, so CHIP is nothing but C for cyclophosphamide, H for hydroxychloroquine, which is the most important one, I for ibuprofen as an NH for pain, and P for prednisolone to reduce the inflammation. So this is all about SLE. Thank you.